Hello, this is a short eCourse in Cultural Awareness Guidance for Surgeons. The need for this course was highlighted during my research on equality and diversity and curriculum changes. For this research, I interviewed groups representing all of the 9 protected groups: age, disability, gender, religion and belief, and so on. The leaders of these groups told me of a need for instruction in cultural awareness for surgeons. My name is Margaret Murphy, and I have written and produced this short eCourse. As you know, the UK is a multicultural society. It includes many people from different cultures. You yourself will be from one culture and will work with those from different cultural backgrounds. Patients, consultants, trainees, or members of any healthcare team may all include culturally different others. It's important, therefore, for surgeons to have some knowledge about other cultures and how they communicate. You probably already know that cultural misunderstandings can lead to problems in surgery and in any walk of life, and can even damage professional relationships. Patient care may suffer as a result. Here we have a picture showing Mr. Mahmoud Ahmadinejad, a former president of Iran, on the left. He's being offered the hand of a political leader from the West, who's expecting the president to respond. However, in Iranian culture, a woman would not offer her hand to a man like this in public. Instead, for a Western woman, it's preferable to bow to greet an Iranian man, especially one of high office as in this example, and wait for him to initiate a further handshake if he feels comfortable. In surgical practice, when cultural misunderstandings happen, possible scenarios such as these could arise. A trainee could become defensive when she feels dismissed and not give her best performance. Or a trainer may display hostility when his cultural values are ignored. Anger can result. Or if a consultant doesn't respect a trainee who comes from another culture due to a lack of understanding of that culture, the trainee may feel unimportant or not appreciated. Or a trainee may be insensitive to the culture of the consultant and offend him. That consultant may feel insulted. The end result? Relationships can be damaged and learning may not take place. This eCourse will give you some guidance on how to speak to people from different cultures in surgical scenarios. It will show you some typical characteristics of other cultures. Importantly, it will give you some suggestions and tips on better ways to interact with each other in more culturally appropriate ways. This can only lead to more positive relationships between the theatre team and with patients, improved training, and better healthcare for all. But cultural awareness is not only a good thing to know about, it's also becoming a formal requirement for surgeons. Let's take a look at some of those requirements. In Domain 1 of good medical practice, there's a requirement that all doctors must have an understanding of cultural and social factors. The same requirement is in several categories of the current professional skills and leadership syllabus. In Domain 2 of the forthcoming Generic Professional Capabilities Framework, there's a requirement that surgeons must demonstrate effective verbal and non-verbal interpersonal skills and cultural and social awareness. Also in the same framework, it states on pages 23 and 27 that surgeons must understand global and multicultural aspects in delivering healthcare. In the new standards for postgraduate curricula, it states in Theme 2 on page 15 that the curriculum must make sure education and training is fair and based on principles of equality and diversity. So you see, learning about cultural awareness is not only helpful for surgeons, it's also becoming a mandatory part of your training. This eCourse will help with those requirements. The first module is on language. This presentation will cover Module 1. It takes about 45 minutes to 1 hour to complete. You can stop the presentation at any time, pause, rewind, or come back later when convenient. Further modules for the eCourse are currently under development. These modules will cover further areas of cultural awareness for surgeons. In all modules, there are instructions, videos, suggestions, tips, and question and answer activities. There's a link for these activities at the completion of this presentation. But it's important to note that there are no right or wrong answers for the questions. They are there solely as a guide to enable you to begin thinking about the important subject of cultural awareness presented here today. After completing all the modules in this eCourse, you will know how cultures differ in the use of language, how to show consideration towards people of different cultures, how cultures differ with regard to status and power, and how to avoid offence. You can also apply for 10 CPD points at the completion of all modules. This eCourse has been approved and accredited by the Royal College of Surgeons of England, and as such, offers these points upon completion. You can also upload and add to the evidence section on your ISCP account or into your appraisal portfolio that the eCourse has been completed. This adds to your evidence for your ARCP or for your revalidation. Good luck. I hope you enjoy it. Now I'm going to discuss language and how we use it to communicate what we want to say. Different cultures use language differently to get the same message across. Sometimes people use direct language to get their message across. Direct language has minimal words or politeness expressions, but the message is clear, if abrupt. However, direct language can be offensive to others from different cultures. They may prefer more indirect language where the message is supported by lots of politeness expressions. A message said indirectly is often not as clear as a direct message, but it avoids the risk of offence. But first, let's have a look at the learning objectives of this module. By the end of this module on language, you'll know how direct language and bad body language may cause offence, how indirect language may not be easily understood by those from other cultures, how to recognise your own language style, how to adapt language for different cultural situations, and how to adopt appropriate body language. As I said, some cultures prefer more direct language and other cultures more indirect. Each culture has a preference, and each culture could be placed on a continuum. Each method of communication could also be placed on a continuum, with each one has advantages and disadvantages. Direct language has clarity, but it runs the risk of offence, while indirect language is less likely to cause offence, but some clarity may be lost in the process. Sometimes people in a higher status position, like a consultant, use direct, abrupt language at someone who's in a less powerful position, like a trainee. Sometimes if a message is said too indirectly, the message may be lost and people from other cultures may not understand. I'm sure you'll know some likely scenarios in your practice where this has happened. Here are some other scenarios. A trainer gives an abrupt order to a trainee who then takes offence. Offended, the trainee does not volunteer relevant information back to his trainer. Or a trainer does not understand the language of her trainee. It's too indirect and the important message is lost in the words. Or when a trainee does not understand the message said to him by his consultant, he does not check back for clarity. In the trainee's culture, the consultant has higher status, and the trainee therefore cannot ask for clarification. He may lose face if he does. Consequently, the trainee's tasks are not done properly because he didn't really understand the directives. Bad feelings result, and relationships may be damaged. As I said, there are different ways to say the same thing, and each culture has a preference. Let's look at the many ways we can say, for example, a simple request. The direct way to say this request is on one end of the continuum. The language on the left starts off as being very direct, but as we go along the continuum, it becomes more indirect. You can see how direct language has more clarity and is more efficient. But in another context or another culture, the same message may be said more indirectly on the continuum of preference. You can see how the same message on the right said indirectly is less efficient. Again, there's no right or wrong way to say this request, but it's important to know that some cultures like the language one way or the other. Each culture has its own preference, and it's important to be aware of that. What is your preference? How would you give this request to your trainee? To your consultant? What is the preference in their culture, do you think? Sometimes people say one thing and mean another. Look at the man speaking on the telephone. What he is saying is the opposite of what he's thinking. These are cultural customs, and every culture has them. It's important to be aware of this. Here are some examples of this in the English culture. Look at the differences between what the English people say on the left, what they mean in the middle, and what others from different cultures may understand on the right. I'll give you a moment to read these and see if you agree. It's no wonder that there are so many miscommunications between people from different cultures. Now, we're going to look at a video of an interaction between a consultant and a trainee. In this video, the consultant is not culturally aware. Her language is not appropriate for her trainee, who comes from another culture. She's told her trainee she wants him to do 3 procedure-based assessments, or PBAs, by the end of the week. Please read the surgical scenario. While watching the video coming up next, listen to the direct or culturally inappropriate language being said by the consultant and see if you use language in this way. Now, please watch the video.
Well, that went well, didn't it? Well assisted.
Thank you, Miss Howe. Thank you.
Yeah. Oh, well, now I'm back from holiday, actually. I want you to help me with some PBAs this week. Is your ARCPs coming up?
That's right.
Yeah, there's actually a chance for you to do an open hernia repair tomorrow, and I notice you don't have enough evidence of this on your e-logbook.
No, Miss Howe, I think I showed you my e-logbook before you left on holiday.
Oh, yeah, that's right, you did, didn't you?
I've done some
Yeah.
hernias. Obviously, I need to do more, but I've done some.
Yeah, right.
But I haven't done that many open.
Oh, for goodness sake, come on, you've just seen me do an open hernia repair. It's easy. Oh, look, it's in all the textbooks anyway, and you know what, you can read up on it tonight. And we'll run through the steps tomorrow before the procedure, so don't worry about it. Oh, actually, I want you to come in early tomorrow to consent the patient as well, okay?
Sure, I get in at 7:30 normally.
Yeah,
so,
no, that's fine. And oh, there was something else I had on my list to do this week. Oh, yeah, that's right. I've got a right hemicolectomy on my list to do on Thursday that I need you to assist me with.
Absolutely, Miss Howe, thank you very much.
Yeah, brilliant.
That's quite a difficult operation because it's quite a difficult tumour.
Yeah, I know. But don't worry, you'll be with me anyway, so it'll be fine. I want you to do the anastomosis for it, so... Oh, and what was the other thing that I had on my list for you to do? Oh, yes, there's a golden opportunity for you to do a circumcision on the daycare list on Friday. Now, I noticed that you haven't done one of these before, but, you know, now's as good a time as any to do one, don't you think?
Miss Howe, that's really kind of you, really kind. Thank you so much for all those opportunities. I assume you want all of those as my PBAs.
Yeah, of course I do, yeah, absolutely.
Miss Howe, the only thing is, I don't know if, I think I mentioned it to you before, you were left on holiday. I've got my MRCS exam next week.
Yeah, that's what I think you might have mentioned it,
and I'm really stressed because I've taken no annual leave or study leave. It's been really busy here covering people.
Right.
And I've had no chance to study for it really, and I'm really stressed about it. So I was just wondering, please, Miss Howe, if I could do those PBAs that you kindly offered the week after my exam.
Well, look, exams are just knowledge, and I'm sure you probably studied for it anyway, so I'm sure you'll be fine.
But I haven't studied. I've taken no study leave or annual leave to study for it.
Look, I can appreciate that you're stressed. I've been in your situation before, but these procedures are on my list to do this week. Look, you know I'm a busy surgeon, and I'm sure you can appreciate that I can't be taking up too much of my time running around trying to find other opportunities for you. Isn't your ARCP the week after next?
It is.
Yeah, exactly. And don't you need enough evidence to show that you've done these procedures on your portfolio in order for you to actually pass your ARCP?
No, I do, and certainly that is
yeah,
my
and you want
priority.
to pass your ARCP, don't you?
I do, but I've got my exam as well.
Well, you know what, look, it's up to you whether you take it or not, but, you know, as your educational supervisor, I would strongly recommend that you take this opportunity. You want to pass, don't you?
Yeah, but my exam, sure, and the
ARCP. Yeah, exactly.
The
well, then I guess it's settled then. If you want to pass your ARCP, we'll do these procedures on my list next week. Right, see you later.
Now, I'd like you to reflect on the language in this video. What was wrong with it? How could it be improved? Why is the trainee not responding to his consultant? How could the language be more culturally appropriate? At the end of this presentation, you'll see a link to some questions and answers that you can note any reflective comments on this video. A Word document will open up and you can save your answers and reflective comments to your own computer. Now, I'd like you to watch another video. This time, the language is different. It's the same scenario with the same consultant and the same trainee, but the body language and the verbal language are different. This time, the language of the consultant is more culturally appropriate. Please read the scenario. Now, I'll play the video.
Well, I think that went well, didn't it?
Yes.
How's everything with you? It's been a while.
Yes,
Yeah.
It's okay.
Yeah, I've just been back from holiday, so
Yes, I know.
got to get back stuck into it. I was actually going to ask you, how do you feel about assisting me with an open hernia repair with me supervising? If you can do, it would be good to do a PBA on it for your ARCP. It's coming up,
yes.
isn't it?
Yes, Miss Howe, it is, yeah. It's in 2 weeks' time.
Okay.
Hernia repair. I haven't done one of those before.
An open hernia repair? Haven't you done that procedure before?
What does it involve?
Well, if you like, I can go through the steps with you, and you know, that way you'll get a better idea of the procedure before the actual day.
Yes, Miss
Would that
Howe,
be okay?
That would be great, yes. Yes, that would be nice. I've got some old books describing.
Well, that's okay. I know it's difficult for you to sometimes have a knowledge of all of the procedures.
Yes.
It is hard for a beginner trainee. I know I've been there myself. Do you have any old textbooks, did you say, that might show you the steps of the procedure?
Well,
It might be good for you to be briefed up a bit before I show you how.
Yes, I was just thinking about that, Miss Al. I mean, I went to the hospital library. They've got some old textbooks there which are quite useful. I can
Okay.
look at those tonight.
Okay, well, yes, also, maybe if you have a look online, there are some really excellent online texts that show good illustrations of a breakdown of an open hernia repair.
Oh, okay.
In fact, if you like, if you pop by my office later, I can show you some sites that I use myself from time to time on surgical procedures.
That would be really good, Miss Al. Thank you. I really appreciate that. It's very kind.
Okay, well, let's have a look at my daycare list so that we can factor in a run-through of the procedure before Friday. Right, let's see. Okay, there's a right hemicolectomy on my list on Thursday, and also a circumcision. Right. How do you feel about assisting me with these as well? You could do the anastomosis and then that afternoon the circumcision. Both look like fairly straightforward cases.
Yes, Miss Al. Oh gosh, anastomosis and hernia. I haven't done those either. Is that in addition to the hernia repair?
Well, yes, I was thinking you could do them all this week. I mean, there's plenty of time between the procedures, and I could give you some instruction after as well. I've noticed that you haven't performed a right hemicolectomy before, and I think it's actually a golden opportunity for you to do it now. Be a great chance to improve your suturing skills. What do you think?
Oh, Miss Al, I agree with you. That's really kind of her. But the thing is that I don't know if I told you that just before you went on holiday, I think I did mention it, but I can't remember if I mentioned it or not. But I've got my exam coming up, and I'm really stressed. You know, my MRCS exam.
Oh,
and
yes,
then after
yes.
that, it's Diwali because my family's coming from India, and
No.
I'm just, I was just wondering if we can do these after all that, maybe after the 20th of October, possibly.
Would you like some more time?
Yes, Miss Al, really.
Yeah. Well, okay. Let's have a look. So I know that it's really important to have a work-life balance with family and festivals and everything. So that's absolutely fine. And it's also really important for your MRCS exams. I remember in my day, I took ages to revise for them. I practically needed 6 whole months just to do them.
Really?
Yeah.
Gosh, I don't think I'll need. I don't think I'll need that long myself. But yes.
Well, okay. Let's have a look. These procedures we're talking about, the open hernia repair, the right hemicolectomy, the anastomosis, they can all wait, sure. There will always be other opportunities. I'll just adjust my daycare list. I can always get another trainee for them in this week.
Okay, Miss Al. Yes, that would be great, Miss Al. Yes, I'd really appreciate that.
Well, no, absolutely. I mean, we don't want you failing your MRCS exams, do we? In fact, I want you to do well and be proud of your results.
Oh, thank you, Miss Al. That's very kind of you.
But what do you think about setting an alternative date for these procedures?
Well, I'm just. Yes. Well, Diwali's on the 20th of October. I've got my
Okay.
MRCS exam before then.
Right.
I mean, Miss Al, would it be okay if I do it after the 20th of October?
After the 20th.
I'm sorry to
let's
ask.
have a look. That's okay, let's have a look. Okay, well, let's pencil it in. Why don't we meet at 8 a.m. on Wednesday? How about that? Would that
8
work
a.m.
for you?
Wednesday. Yes,
Yeah,
Miss Al.
okay.
Yes, that's very kind of you.
Brilliant. Well, let's pencil that in.
Okay.
And also, don't forget to pop by my office later so that you can check out those websites.
Yes.
Yeah?
Okay, yeah. Yes, Miss Al. Oh gosh. Would 6 o'clock be okay? Because I've got a ward round to do, before then. And
6
well,
o'clock,
I'm
yeah?
pushed for time. Yeah.
No,
right,
that's-
because the ward round's quite important.
6 o'clock works for me, that's absolutely
The
fine.
registrar will want me there and all the rest of it.
Yep, no, I understand completely, that's fine. If you pop by my office at 6 o'clock and we
Okay.
can go through them, they'll actually help you with your MRCS exams.
Oh, right, okay.
I should know, I help write the content, so
Oh,
let me know
right.
your impressions of the text
Wow,
as well.
you wrote the contents well. I'll definitely make sure I study harder for them then. And yes, Miss Al, I'll see you later on. Thank you very much.
Okay,
That's
not
really
a
kind.
problem, thank you.
Now, Now, I'd like you to reflect on the language in this second video. Why is this language better? And why is the trainee responding to the consultant? What is the consultant being aware of? And how is the language more culturally competent? Again, as in video 1, you can complete some question and answer activities and note any reflective comments on this second video at the end of this presentation. A Word document will open up and you can save your answers onto your own computer. Language. How does it compare? Let's look at the difference in both body and verbal language between videos 1 and 2. In video 1, the body language of the consultant is not culturally appropriate. There's reduced eye contact. She's standing too far from the trainee. And her facial expression is distant and unfriendly. How do you think this makes the trainee feel? What is the effect of that body language on his learning today? The trainee may feel alone, separate, excluded from the consultant, and maybe even intimidated. And he's not a happy trainee. Now let's compare that with the body language in video 2. In video 2, the body language is different. Did you see the difference? How was it better? The consultant now is culturally aware. She knows that her trainee comes from another culture, and as such, she knows he may be feeling intimidated by her, and he may not feel able to ask for help or be able to say no to her. She's aware of this and adapts her body language accordingly to make a comfortable start. Let's look at the skillful ways she does this. She makes eye contact with him in a pleasant, welcoming way. She ensures he feels included by and attended to by standing near him. She smiles to encourage him, and she displays a friendly expression so that he now feels comfortable. But what about her voice? Its pitch, tone, and projection. How do you think it's changed from video 1? And what about the effect on her trainee? Here are some of the positive effects her body language has on him. He now may feel attended to, important, included, and comfortable. And he's happy. Now let's look at the important verbal language differences between video 1 and 2. In video 1, the consultant uses direct language. She demonstrates a lack of interest in her trainee. She also uses demanding and unfriendly language. She does not realise her trainee comes from another cultural background and does not adapt her language accordingly. What's wrong with her language, and how is it not culturally appropriate? Do you use language in this way? Her language is direct, demanding, impolite, and it's showing a lack of interest. It's unhelpful, it's even putting down or a bit superior, and it's also unfriendly. But what about the trainee? How does this make him feel? He may feel unimportant, pressured, a lack of encouragement for him and his surgical training. He may feel anxious, and he may experience a lack of understanding from his consultant. He's not happy. At the end of this presentation, there'll be a link to see more examples of how the language of the consultant lacks cultural competence and the resultant negative effects on her trainee. Now, let's look at the verbal language in video 2. By contrast here, the consultant uses her knowledge of culture and adapts her language. She makes her language more indirect and is showing interest in him. She tries to assist him with language. She also senses that her trainee's English skills may not be perfect, so she uses language to check back to see if he's properly understood her instructions. She tries to offer some solutions because she empathises with him at this difficult stage of training, as she was once in this position herself. By showing her vulnerabilities that she needed a lot of extra time when she was a trainee, the consultant enables the trainee to feel more comfortable and relaxed. He understands that he's not the only one who needs help at this stage of his training. He feels understood and even laughs with her. And this not only forges the professional relationship between them, but it assists his development as a surgeon. But what about the effects on her trainee? He now feels considered, befriended, comfortable, encouraged to learn, and assisted in new surgical skills. And he also knows he'll be rewarded for learning these vital skills. And he's a happy trainee. At the end of this presentation, there'll be a link for more examples of the consultant's skillful way she uses language in a culturally competent way. But what is the overall effect on the trainee? Because the consultant in video 2 is culturally aware and uses her language accordingly, here are some further positive effects on him. He senses that his own knowledge counts and is important. He now feels comfortable enough to disclose information to her. He may even be able to say no to her, or even give her feedback. Tension is reduced, and a more positive learning environment develops. As well, their professional relationship coheres and he feels closer to her. He can return her empathy because she has shown empathy towards him. Relationships are being built and learning will now more easily take place. And he's happy. What does all this language have to do with learning? And what does cultural awareness have to do with learning? A lot. Let's look at the comparison of the overall learning of the trainee in video 1 with the trainee in video 2. Which way would you rather your trainee learn? Which way would you rather your consultant speak? Let's recap on some of the main points so far. When there's a situation of a power imbalance, as for example between a consultant and a trainee, people from some cultures may have difficulty saying no to a person in a higher status position, such as a consultant, admitting a lack of knowledge, and saying what's really on their minds. The trainee in both videos has trouble doing all of those. He cannot say no to his consultant because, in his culture, it would not be appropriate to do this. He also has trouble admitting a lack of knowledge to her and telling her what's really on his mind. All of these things would not be done in his own culture, as it would reveal a loss of face for him. The consultant in video 2 is aware of this and adapts her language accordingly. She uses both verbal and body language to skillfully counteract these difficulties her trainee is currently experiencing due to his own cultural background. At the end of this presentation, there'll be a link to see more examples of how she displays her cultural awareness to overcome these obstacles above. And there'll also be more question and answer activities. But remember, as I've said, there are no absolute right or wrong answers to these questions. They are there merely as a guide to enable surgeons to begin thinking about the concepts raised today. Let's do a short summary of what we've learnt so far. The key things to remember are: all cultures have a preference for direct or indirect language. Direct language can sometimes be intimidating or offensive to people from other cultures. If language is too indirect, it may not be clear to others from different cultures. Trainees from some cultures have difficulty saying no to a consultant. They may also have difficulty admitting a lack of knowledge or their own thoughts. Pay attention to your body language and make sure it's inclusive, and adopt a friendly, approachable language style. Finally, here are some tips if you're unsure of what to say or do in a situation of cultural difference. Formal tone and indirect language is preferable if you're unsure of the background of a trainee or a consultant. Certain cultures avoid the word no to preserve harmony. So keep in mind that even though a trainee or a consultant may agree with you and acquiesce to your request, in their own mind they may not agree and may not want to acquiesce. People from some cultures experience a reluctance to request clarification if they're unsure of the message. This is to preserve harmony between them and to keep the status difference intact. Instead, they just nod or agree or say yes. It does not mean, however, that they've understood or agreed. Always check back for their understanding or ask them to paraphrase your point or request, and try to tune in to the effects your words are having by closely watching their facial expressions and body language. People from some cultures use non-verbal ways to communicate, for example, with body language, the context or the situation around them, or just silence. In our Western ways, this is not common or even understood by some, but it can be quite important in other cultures. So, allow others from different cultures some time and space to understand situations without so many words. At the end of this presentation, there's also a link for more in-depth analysis of cultural awareness and how it applies to surgeons, if you'd like more information. But what about the learning objectives we set out at the beginning? Do you remember them? The objectives for this module as well as the forthcoming ones. So let's recap. So far we've learned how cultures may differ in how they use language. In forthcoming modules we'll also learn more on how to show consideration or politeness towards people of different cultures, how people from some cultures react differently to status and power differences, and how to avoid offence. Well done! You have now completed Module 1. I hope you've learnt some new ways to help you in your language and interactions with culturally different others. After the completion of this presentation, please see the links below for Word documents of question and answer activities, further information, and more information on videos 1 and 2. Thanks for watching this presentation. Goodbye.